Good morning. Hope you're having a great week. Welcome to Medical Monday. We're continuing our allergy theme this week, like we have the past 2 weeks, and talking about allergic conjunctivitis. Fancy term for a simple concept. Basically just means allergies that affect your eyes. Now, a lot of times with allergy symptoms, the traditional allergy symptoms, what are they? We know them: sneezing, nasal drainage, watery eyes. Okay, that's kind of the top three, the trinity of allergy symptoms. They're usually easily treated with antihistamines. Most of them now available over the counter. Nasal sprays, even those are now available over the counter. But the biggest change from just having watery eyes to what we call allergic conjunctivitis is an inflammation of the conjunctiva, the area around your eye, and then the actual whites of your eyes. Now, this can be a little tricky in the sense that anytime you have injected or you have red streaks in your eye or you see the blood vessels in your eye, a lot of times we call it just conjunctivitis, period, put you on some antibiotic drops, and have you move along. And most of the time, people do really well with that. This time of year in particular, though, your eye pain or eye inflammation or redness in your eye or both eyes could be caused from allergies to pollen, trees, grass, anything like that. And this is the time of year when those things are really starting to kick up. So what's the difference? Well, having just watery eyes is one thing, but when you start having pain, itching, and redness and swelling, both kind of the soft tissues of your eyes, and you see the redness there within your eye itself, a lot of times, and you know you're having some other allergy symptoms, or it's this time of year, a lot of times a bacteria is not necessarily the root cause, but it's allergies, allergens. And that treatment is a little bit different. We usually do drops, and we may do a different kind of drops. The problem is a lot of times on exam, it's hard to tell. And so you may have a provider who sees you and just says, let's go ahead and do both because it could be either. They may give you some antihistamine eye drops as well as some antibiotic eye drops just to make sure that we're not missing something. Because just on exam, sometimes it's hard to differentiate. Now, you go see an ophthalmologist, an eye expert, they'll be able to get you on something specific. But if you come to an urgent care center, we're going to make sure we cover you for either possibility and get you on probably a couple different medicines if we're unsure. Now, one of the biggest things you notice is that a lot of times with a bacterial eye infection, it'll start one side and jump to the other. Not jump, but move as you rub your eyes and things like that. Allergic can do the same thing. It also can start kind of in both eyes at the same time, but that it just depends. So again, that's not exactly a great way to differentiate. So sometimes it can be tricky to diagnose, but it's definitely one of those things that bothers people all the time this time of year with their allergies. It's different from just watery eyes. We're talking red, injected, swollen, painful, itchy eyes. So if you have those symptoms, know someone that has those symptoms, come be seen. We can help you out. We can help you feel better faster and get you the meds that you need to get on the road to be allergy-free. So hope you have a great week. Stay away from the pollen and the ragweed if you can, and if you can't, good luck. Have a great week. Talk to you soon.